Also heard a lot about, and so just to put a bow on that with the ages, a new case, when people say that, I think given what we know about coronavirus affecting the elderly, is, okay, cases for who? And if it's a lot of 25-year-olds, chances are that's going to have limited clinical significance. I think for sure, if you had 1,000 cases under the age of 30, that would have fewer clinical significance than if you had 15 cases of residents of a long-term care facility, for example. That's just the way the disease tends to work. So that's really important to know who is testing positive, and we've definitely seen a big change here in the last couple weeks. I also think it's important to discuss Florida's hospital system. You'll see these headlines about, oh, this and that. Understand, when we started the pandemic, there was about 12.5% of the available beds were available. Now, there's been anywhere from 25 to 30% of the beds available over the last couple weeks. And in May, when we went to phase 1, part of that was resuming elective surgeries in the hospitals, but that needed to be done, obviously, because there were people that needed procedures. So that allowed them to bring in more people for electives, resume more normal operations, and so the hospitals have continued to do that. But when people report on an increasing census from May until now, just understand that is not being driven by COVID-19 patients. That's being driven by the resumption of their new operations. COVID has always been a very small percentage of the total number of beds in the state of Florida. And it's just very important to understand that, because some of these headlines that you see really leave a false impression, especially when you're talking about different hospital capacity. We had a great event yesterday down in South Florida, representatives of big systems in all the 3 Southeast Florida counties. They're ready. They've got plenty of space. They are, some of the systems like a Broward Memorial, have fewer people than they did, 2 months ago. And that's just, I think, important to point out. It's also important to point out, when you're looking at people coming in who are younger, the acuity is lower, and I think they're seeing that across the board. Every hospital system I've talked to has seen that. And so that's why, even though you have these cases, probably because they're skewing younger, we have far fewer COVID patients in the ICU today, than we did in April statewide in the state of Florida. And I think you've seen different areas, some areas are down overall hospitalizations, some are up, but even some of the ones that are up, still are flat or down with the ICU, which is very important, because, it's saying that the disease burden may not be as significant as it was in March or April. Maybe that's something to do with the virus. People speculate on that. Maybe it's just the folks who are getting infected tend to be in the less vulnerable groups, but very important to point out that that's just where we are, and we're in a much better position today than we were at the beginning of April. Also, when you're looking at positive tests, and particularly, if you want to talk about hospitalizations, everybody going in, I think without exception, but certainly every hospital I've talked to, they are testing at a minimum every single patient that comes in for any type of procedure. So when expectant mothers come in, if you need a knee replacement, whatever it is, you're getting tested for COVID-19, even though you're going into the hospital for something having nothing to do with COVID-19. If you get in a car crash and you end up, they do test you for COVID-19. Some hospitals test everyone that walks through the door for COVID, but a lot of them at least test for that. And what they find is, some of the people test positive, almost all of them are asymptomatic, but if somebody comes in having gotten in some type of an accident and they need attention and then they test positive, they're now considered a COVID patient, even though COVID is not the reason for their hospitalization. And so that's something that's very important to point out as well. So what are some key points? We're seeing this trend younger. We'd much rather, obviously, have to deal with this than have it trend older, which is the vulnerable population. But we're seeing it spread, certainly in the 20s and 30s-year-olds, faster than we would like to see. So we really want to send a message of doubling down on what we've been preaching really since the start, but certainly since the start of phase one, in terms of the social distancing. Some of the other things I'll talk about, the public health advisory that's reiterating some of the guidance. One of the things, though, for Florida businesses, Florida's been very reasonable. We've wanted to get people back to work in a safe way, but we also understood you got to get people back to work. And so you have certain things, whether it's a restaurant, there's certain guidelines, in terms of capacity that's been in there. And I think statewide, people have done a fantastic job. But, you do hear reports about, people just jam-packed in some of these places. That is not what we're looking to do. We want to do it in a very measured way. Let people be able to do some of these things. But DBPR, is going to be enforcing that because there's a reason why it was done that way. It wasn't just pulled out of a hat. It was done in a way to, allow businesses to reopen, allow people to be able to do some of these things, but to do it in a way that minimized risk. And when those, very reasonable guidelines are disobeyed, well, it ends up defeating some of the purpose of what we're trying to accomplish. So, I would just say most people are doing a great job, but we really need everybody on board, particularly some of the places that are frequented by some of the younger people. I've also asked the Surgeon General to reissue a public health advisory with some updated information, and we've been preaching this from the beginning of March, but for the elderly and for people with significant underlying conditions, you need to continue to limit contact with people outside the house, certainly avoid crowds. Also understand that as we're seeing more infections documented amongst younger people, that could potentially pose a risk of transmission. So you have some folks in their 20s, maybe their parents, maybe their grandparents. It's something that people should be considering. But I'll tell you this, if you look at Florida, the senior citizens here have really done a great job at doing the social distancing. I think if you look, probably nowhere in the country has a group of seniors done better with that. So my hat's off to them for what they've done, but we need to continue doing that, particularly as we're seeing what's happening with the younger folks. The social distancing is something, that's very important. It's very reasonable to follow those guidelines. I think people understand what they are. It will make a difference in terms of being able to minimize transmission, again, particularly amongst those 20 and 30-year-olds. In our phase one, we recommended following the CDC guidance on facial coverings when you can't social distance, or if you're in face-to-face business activity. So you see a lot of this with waiters, you see it in, with hairdressers and stuff, and I think they've been doing a good job keeping people safe. So we want to reiterate that guidance for people as well. Of course, if you're sick, stay home, and then practice hand washing and sanitation. Those are just very, very important things that will be able to, to help us, break up some of the transmission that we're seeing with the younger population. But the one thing I'm confident of, having talked to folks around the state, the state's in a very good spot to be able to handle these eventualities compared to where everybody really was in February and March. I mean, we have a very robust testing infrastructure in place. Anyone who needs a test can get a test. One of the reasons you're seeing more positive tests is because of contact tracing. If somebody tests positive and they had close contact, you can go out and actually test the people who have had significant exposure. That's being done. That's identifying more people coming back positive. Again, in those younger groups, it's almost always asymptomatic, but it's important to be able to identify that. So you do have that. The PPE is much better shape than it was before, and obviously people have learned a lot about this illness over the last couple months. One of the things that they're using that's really doing well is the remdesivir that we've worked with HHS to get down to the folks throughout the state of Florida. So we're seeing cases. Those cases are skewing younger, which is the less vulnerable population, less morbidity, less mortality. That's obviously been, I think, well documented, not only here, throughout the country and throughout the world, but at the same time, we're seeing positive tests at increasing rates, which suggests that you're seeing increasing transmission, particularly amongst that group in society. So we want to follow the DOH public health advisory. We want to make sure that folks folks are following the guidelines for phase 1, if you're in that, or phase 2. If you follow the guidelines, things have worked out very well. I think when you depart from them, that's when we start to have problems. So, but the system's doing well. And again, a case is just that, a positive test. It doesn't mean, I see these headlines about 23 Clemson football players test positive, like, oh my gosh, like you think that the way it's framed, that was like some type of a death sentence, and that's just not the reality of the situation. So when you have things like that, a lot of times people don't even know they have it, but even if they develop symptoms in the younger groups, it's usually mild. Again, the morbidity is low, and so we just want to make sure that people understand that, but we also want to make sure everyone's doing their part. So thank you, and look forward to everyone having a happy Father's Day.
Yeah, Governor, if this is a testing issue with the increasing cases, what do you expect us to see over the next few weeks and months?
Well, I don't think it's a testing. I think it's the fact that, you're having more transmission amongst the 20s and 30-year-olds is why the positivity is going up. And I think that's just a function of, we're now 3 months into this. I think that there's a lot of fatigue in terms of some of the social distancing. And of course, from an individual risk perspective, those are the lesser vulnerable in society. There's just no doubt about it. But at the same time, some of the things in terms of social distancing, in terms of some of the physical separation, it will really help us, with that. So I knew from the beginning, and I said this in April when we were preparing to do phase 1, when you do mass testing, when you don't require symptoms and that, you will find more cases. So we expected that. We expected to see more cases. I knew how that would be portrayed, obviously, in terms of, oh my gosh, more cases, more cases. We were obviously more looking at the mortality and morbidity. One of the things that's interesting that you don't see, much in terms of headlines is, since the beginning of May, we've had a, very good downward trend in daily fatalities that are COVID related. And that's something that I think is important. And that's been going on really now for 7 weeks, which is good. But we knew that there would definitely be, there's more tests, therefore it's that. So part of this I expected, but when you see positivity in some of these counties, go from 5% last week to 10%, that's an indication, certainly in that age group, that you're seeing more transmission in the community. So that's why doing some of the things like the Surgeon General's advisory I think is important. I think it does not take that much to really make a difference. And then obviously if you're in those vulnerable groups, to just understand, we are seeing more cases in that age group, and it's not purely just a function of the fact that they're testing more. Part of it is that, but you are seeing a higher positivity rate. So those are things that we've got to tackle, and we're looking forward to doing that.
Governor, why would you not want to put out a mask order, a statewide mask order? Even, I think Governor Doug Ducey in Arizona did a suggestion, suggesting locals pass.
So on my original order for phase 1 that we issued, I guess at the end of April, we recommended everyone follow the CDC guidance. So that's in there. If you can't social distance, it's recommended to wear a facial covering. And then if you're in those face-to-face businesses, hairdresser, some of the servers at the restaurants. So we have recommended that the whole time. I've not preempted locals from doing, what they think is right. But at the same time, you have to enforce that, and you have to make a decision about what type of penalties you think are appropriate. I think statewide penalties would be problematic for a whole host of reasons. And I think we just got to trust people that, give them the opportunity to do the good things, make good decisions. I think that tends to work better than to mandate this, mandate that. And so I think that's good. But we've been very clear from the beginning of May on that. CDC, obviously the health, kind of intelligentsia, they were saying don't do masks in February and early March, and now they're saying, it's pretty good. So I think there's been a lot of mixed messaging from the public's perspective, and so when they look at it, and if you say you're going to be prosecuted if you don't wear a mask, they're going to say, well, geez, they were telling me not to wear one in March. Now they're saying to do it. So I think that's part of the problem too. But I think we've been sticking with that as being something that's prudent. I know Mayor Jimenez has done that in Dade, and I think they've done it in Broward as well. And we've supported local folks, taking those types of measures if they think it's appropriate. Now, if you're not enforcing it once you go down that road, or you're enforcing it unevenly, or if we're kind of getting more police interactions with folks, whether that's the right thing we want to be doing at this point in our history, I don't know. But I do know that we're going to trust people to make good decisions. Yes, sir.
About Governor Cuomo's considering of a quarantine on travelers from Florida?
Well, I think governors have, prerogative to do what they need to do. I would just ask if that's done, just please do not quarantine any Floridians in the nursing homes in New York.
Mayor, you said mixed messages about masks, but most of your staff here is not wearing masks, and they usually don't wear masks.
Okay, and how far away are they from everybody? I mean, he's not within 20 feet. Helen's not within 20 feet of everyone. So if you can social distance, if you can't social distance, then it's there. If you're going to maintain physical distance, then that's something that's different. Now, when you're in public situations like at a grocery store or something, obviously whether you can count on physical distancing, that may be a different calculation, but I think people here have worked really hard to just maintain the proper distance, and I think that that's something that's totally appropriate.
Would DBPR enforce masks for restaurants, for owners and operators who aren't wearing masks?
DBPR will enforce everything that's in the guidelines. Yeah, absolutely. I think, we haven't heard as much complaints about that, to be honest with you. I think most of the restaurants, want to do a good job there. Of course, it's not in their interest to have anything happen. I think when that happens, that's not good for business. So I think that they've, by and large, been very careful. But we have heard more about the capacity at some places. And when we first started this, when it was the middle of March, some governors just went, shut all the restaurants down, takeout only. I went initially to 50% because I was like, okay, why do we want to put someone out of business? 50% is adequate separation, and I think it's low risk, and I think that's true. But what was happening was, I get calls, people say, I'm doing this guy across the street, it's just packed. And so we were like, all right, well, we're not gonna police that. So here, now that they had that period, had an opportunity now for 7 weeks to be back up going, and we would just ask that they follow that. There's a reason why that's being done, and look, we don't necessarily have it's because of this or that in terms of some of the younger transmission. I think we're working through to try to see, what would have happened, particularly, over the last 3 or so weeks. What, if anything, has changed from where we've been over the last 2 months? But I just think that sticking with the program is probably the best thing to do.
Were you involved? There are lots of businesses that obviously are regulated by DBPR, like restaurants and hairdressers, but then there's lots of businesses that are reopened that DBPR does not regulate. So if those businesses are not adhering to the reopening guidelines, like doctors' offices may be doing procedures without COVID testing first, because they're not.
Well, but we're not
doing on the non-DBPR regulated side.
So, some of the doctor's offices, we've not necessarily said everyone needs to be tested for that. That's something that I think a lot of hospitals have done, and I think that that's fine. But, ACA will regulate them. But I can tell you, at least from the hospital perspective, I think that they've done a really good job. They've had a lot of different things they have to deal with. They've learned very quickly. If you look in Florida and you look at the fatalities per 100,000 here, and then compare them to some of these other states, we're much lower, and I think there's a number of reasons for that, but certainly one of them is I think the folks in these hospitals have really done a good job in terms of treating the patients.
Two more questions.
So, what scenario? Are you at a point of no return? What scenario can you foresee where you would have to reimpose some of the measures you took earlier on, or are you politically in a hard place right now?
It's not political. It's, you're in a situation where the whole reason the mitigation was done was to flatten the curve so that the hospitals weren't overwhelmed. And we, didn't 100% know what was going to happen. So as we took measures in March and early April, by the time we got done at the end of April, it was clear we had massive space in the hospitals. It was clear that we were able to handle whatever came way. And then since that time, you've had a major testing infrastructure put in place. You have the PPE that that logjam has been released. So you have more PPE than we had at that time. You now have things like the remdesivir, which are being used to treat patients. We know, we have way fewer patients on ventilators today than we did in April. And then obviously, the daily fatalities have continued to trend down irrespective of the cases. And so I'm confident that the healthcare system will be able to handle. Obviously, doing some of these things, can help minimize the spread, even if it's in a low-risk group. We think that that's something that's important. But that mission of protecting the hospitals and not having them get overrun was something that was important. We obviously were able to accomplish that as this thing came through. Now we're dealing with spread. A lot of it is in the younger populations. So we're going to deal with it. But I think that the system is good. I think the tools there are stronger than they were before. So it just wouldn't be appropriate to take some of those actions given that we have the hospital system in good shape. Yes, sir.
Governor, you outlined some other reasons why percent positivity might be going up and why hospital visits for COVID and influenza-related symptoms might be going up. But those are two metrics that are part of the reopening process and whether you should reevaluate. So now at what level are you thinking you might have to?
Well, a couple things. One, I think we're finding out a lot of new information about what's going on. You do have visits, but they tend to be younger people. And then even the hospital admissions have skewed younger, and there's been less acuity. And so that's just the reality. So that's why, you go back to April to now, the ICU COVID hospitalizations are down significantly than where they were. And so those are things that obviously, you take into account. But I think that given that we're seeing the spread with the younger population, they are less risk. Remember, in Florida, 86% of the COVID-related fatalities are age 85 or above. And in fact, 65 or above, 65 or above. And there are more fatalities over the age of 90 that are related to COVID than are under the age of 65 combined. So the at-risk group is something we've worked on. We were able to test, or at least offer a test to every nursing home in the state, both staff and residents. Now we're going to be periodically testing the nursing home staff every 2 weeks to make sure it's not brought in where it would harm those nursing home residents. And that's something that's very appropriate. And I think if you look, compared to other states, if you look at the long-term care resident fatalities per capita, we've obviously done a lot better than many of these other states. I think it's because of some of those actions we've taken. But if you look, the vast majority of the COVID-related fatalities that have happened, certainly since May, have been long-term care related. So that is where, we need to continue to put the effort. The general public has continued to decline. You haven't seen high mortality, and so obviously we want to keep that going. But again, the cases are one thing. And then we are obviously looking at what's happening with some of the visits for some of the symptoms. And one of the things that's happened is because, we went from not caring, not we, but the media didn't care about this for 2 weeks with the protest. That was off the front page. And then that was kind of doing that. And then when that died down, this became something. And it has affected people in terms of they're going to get tested. You look, we were begging people to get tested a month ago. And now you see people going to get tested. I think part of it is you're seeing more people, make these visits because they're concerned about some of the stuff they're seeing. So we're going to see, we'll be able to see how it shakes out. But I think we understand, particularly in the Tampa Bay area, particularly in Central Florida, we're definitely seeing the younger demographic in those areas that are testing positive at higher levels. You are seeing stuff in Broward, Dade, Palm Beach, but it's probably well, at least in date, I think it hasn't skewed quite as young, younger than they were, but probably not quite in 20s and early 30s. And then some little bit in Northeast Florida. So we want to continue to work on that, work with them, and just make sure that people understand that. And we said this from the beginning. The virus doesn't just go away. It's something that we've got to deal with. It's something that I'm confident we can deal with. And but people should just understand, just because it fell off the front pages didn't mean that it disappeared. Now it's back, I think, in terms of what's being focused on. So in some ways, even though I don't like to see things about, oh, there's no hospital space for this, at least it's out there, and I think people are now thinking about it again. So some of these things, like these advisories, I think people are going to be interested in doing their part. And I think if we do that, I think things will be in good shape. I wish that I knew there would be more cases for sure, but I've been a little surprised to see some of the younger folks, the way that was. So we just want to make sure we're putting out the message, take the proper precautions, understand that the social distancing stuff is still important. Even though you may not be as much of a personal risk, you can do your part to help stop the spread and hopefully protect those who may be a little bit more vulnerable to it. Thanks.
Thank you, everyone.
All right, there you have it. Governor Ron DeSantis in Tallahassee with an update on the COVID-19 response. So here's a few things he talked about. First off, he says the vast majority of the new cases are people with no symptoms, and these are young people in their 20s and 30s. And he mentioned Duval County. The average age, the median age right now for the new cases in Duval is just 29 years old. Meantime, he also said he is doubling down on social distancing and masks. He's encouraging people to do that. And also, he says there's more positives in addition because of contact tracing, so they're able to track it a lot easier than before. One of the things the governor pointed out. And as far as masks go, he said that he's still not going to mandate masks being worn across the state. He says enforcing that will be problematic. He wants to leave it up to the local municipalities to make those decisions. And that's about all from the governor at this time. We'll have much more coming up tonight on Action News Jax at 6 on CBS 47. Now we'll send you back to our regularly scheduled programming.
This has been a CBS 47 Fox 30 Action News Jax breaking news update. For continuing coverage of this story, download the Action